Question 401. An 80-year-old aphasic CVA client had abdominal surgery 2 days ago. Which of the following puts this client at the highest risk for inadequate pain management? A. Inability to turn, cough, and breathe deeply. B. Inability to communicate pain. C. Inability to ambulate freely. D. Inability to use a bedside commode. Answer B. Explanation. The client cannot speak to alert the nurse to his pain state. The nurse needs to provide alternate methods of communication with the client. Basic hand comfort. Question 402. Elderly persons with pernicious anemia should be instructed: A. To increase their dietary intake of foods high in B12. B. That they do not need to return for follow-up for at least a month after initiation of treatment. C. That oral B12 is safer and less expensive than parenteral replacement. D. That diarrhea can be a transient side effect of B12 injections. Answer D. Explanation. Pernicious anemia is a megaloblastic, macrocytic, normochronic anemia caused by deficiency of the intrinsic factor produced by the stomach. This results in malabsorption of vitamin B12, which is necessary for DNA synthesis and maturation of free RBC. Education should include side effects of vitamin B12, which can include pain and burning at the injection site, peripheral vascular thrombosis, and transient diarrhea. Physiological adaptation. Question 403. When a woman is receiving postpartum epidural morphine, the nurse should plan to observe for which of the following side effects to occur within the first 3 hours: A. Nausea and vomiting. B. Itching. C. Urinary retention. D. Somnolence. Answer B. Explanation. A side effect of postpartum epidural morphine is the onset of itching within 3 hours of injection and lasting up to 10 hours. Nausea and vomiting might occur 4 to 7 hours after injection. Urinary retention is a side effect of postpartum epidural morphine, but is not assessed as such within the first 3 hours. Somnolence is a rare side effect. Health promotion and maintenance. Question 404. During the work phase of the nurse-client relationship, the client says to a primary nurse, "You think that I could walk if I wanted to, don't you?" What is the best response by the nurse? A. Yes, if you really wanted to, you could. B. Tell me why you're concerned about what I think. C. Do you think you could walk if you wanted to? D. I think you're unable to walk now, whatever the cause. Answer D. Explanation. This response answers the question honestly and non-judgmentally and helps to preserve the client's self-esteem. Choice 1 is an open and candid response, but diminishes the client's self-esteem. Choice 2 doesn't answer the client's question and is not helpful. Choice 3 increases the client's anxiety because their inability to walk might be directly related to an unconscious psychological conflict that has not been resolved. Psychosocial integrity. Question 405. In administering an SAID adjunctive therapy to an elderly client with cancer, the nurse must monitor: A. BUN and creatinine. B. Creatinine and calcium. C. HGB and HCT. D. BUN and CFT. Answer A. Explanation. Elder adults might be more at risk for gastric and renal toxicity, increasing among elder adults. Basic hand comfort. Question 406. With a brief presentation, the nurse must be particularly alert for which of the following: A. Quickening. B. Ophthalmia neonatorum. C. Pica. D. Prolapse umbilical cord? Answer D. Explanation. Prolapse umbilical cord is the descent of the umbilical cord into the vagina before the fetal presenting part and compression of the cord between the presenting part and the maternal pelvis, compromising or completely cutting off fetal placental perfusion. This is an emergency situation. Immediate delivery should be attempted to save the fetus. Physiological adaptation. Question 407. In infants and children, the side effects of first-generation over-the-counter (OTC) antihistamines such as diphenhydramine and hydroxyzine can include A. Reye syndrome, B. Cholinergic effects, C. Paradoxical CNS stimulation, D. Nausea and diarrhea. Answer C. Explanation. Typically, first-generation OTC antihistamines have a sedating effect because of patched into the CNS. However, in some individuals, especially infants and children, paradoxical CNS stimulation occurs and is manifested by excitement, euphoria, restlessness, and confusion. For this reason, use of first-generation OTC antihistamines has declined and second-generation product use has increased. Reye syndrome is a systemic response to a virus. First-generation OTC antihistamines do not exhibit a cholinergic effect. Nausea and diarrhea are uncommon with first-generation OTC antihistamines. Pharmacological therapies. Question 408. A client tells the nurse that his wife's nagging really gets on his nerves. He asks the nurse to talk with her about her nagging during their family session tomorrow afternoon. Which of the following responses is the most therapeutic for the client? A. Tell me more specifically about her complaints. B. Can you think why she might nag you so much? C. I help you think about how to bring this up yourself tomorrow afternoon. D. Why do you want me to initiate this in tomorrow's session rather than you? Answer C. Explanation. The client needs to learn how to communicate directly with his wife about her behavior. The nurse's assistance enables him to practice a new skill and communicates confidence in his ability to confront this situation. Choices 1 and 2 inappropriately direct attention away from the client and toward his wife, who isn't present. Choice 4 implies that there might be a legitimate reason for the nurse to assume responsibility for something that rightfully belongs to the client. Instead of focusing on his problems, Hal wastes precious time convincing the nurse that he or she should do his work. Psychosocial integrity. Question 409. For clients requiring total oral care, it is important for the nurse to A. Assemble all equipment. Assist the client to semi-Fowler's position and place a towel on his chest. B. Place client in Fowler's position, prepare the equipment, and tell the client what to do. C. Assemble all equipment. Place the client in a side-lying position and place a towel under his chin. D. Use gloves and clean the client's mouth, including the tongue. Answer C. Explanation. Assemble all equipment first. Place the client in a side-lying position so that fluid can easily flow out or pull in the side of the mouth or suctioning to prevent aspiration. And then place a towel under the client's chin and a curved basin against the chin. Gloves should be worn. Basic hand comfort. Question 410. A female prostitute enters a clinic for treatment of a sexually transmitted disease. This disease is the most prevalent STD in the US. The nurse can anticipate that the woman has which of the following? A. Herpes, B. Chlamydia, C. Gonorrhea, D. Syphilis. Answer B. Explanation. Epidemiological studies indicate that chlamydia is the most prevalent sexually transmitted disease in the US. Physiological adaptation. Thank you for watching.